So what is harm reduction? You're looking at the website for the Harm Reduction Coalition that provides a lot of great resources to help understand what harm reduction is. And I want to cover with you what the principles are and then give an example using the condition of diabetes to kind of help bring it home and help us understand what this means for people. So harm reduction is a set of practical strategies aimed to reduce negative consequences associated with drug use. It's also a movement for social justice built on the belief in and respect for the rights of all people, including those people who use drugs. Harm reduction can incorporate a broad spectrum of strategies for safer use, from abstinence to meeting drug users where they're at, and addressing the conditions of use along with use itself. So I'm going to share the principles outlined here with you and talk a little more about them. Harm reduction accepts that for better or worse, illicit drug use is part of our world and chooses to work to minimize the harmful effects rather than just ignoring or condemning them. Drug use is complex. It encompasses a continuum of behaviors from severe abuse to total abstinence and acknowledges some ways of using drugs are clearly safer than others. For example, if you're injecting drugs, it would be a lot safer to use sterile syringes than use syringes that could spread infection. Harm reduction establishes quality of individual and community life and well-being, not necessarily cessation of all drug use as their criteria for successful intervention. So meaning we're really focused on quality of life for individuals and communities, not solely on abstinence. Harm reduction calls for non-judgmental, non-coercive provision of services. So we provide services and resources to people who use and the communities in which they live to assist them in reducing their harm in a non-judgmental way. Harm reduction ensures drug users and those with a history of drug use have a real voice in creation of the programs and policies designed to serve them to make sure that they actually do serve them. Harm reduction affirms drug users themselves as the primary agents of reducing harms of their use. They're in charge. We're empowering folks to share information and support each other. Harm reduction recognizes the reality of poverty, class, racism, social isolation, past trauma, discrimination, etc. affect both people's vulnerability to and capacity for effectively dealing with drug-related harm. Some people have a lot of things that can support their recovery while others don't. Harm reduction does not attempt to minimize or ignore the real and tragic harm and danger associated with licit and illicit drug use. So that was sort of a summary of the harm reduction principles, but let's think about this in terms of diabetes. If we have a patient who has diabetes and we know that their blood sugars are really not well controlled and that the best medication for them would be to inject insulin to bring their blood sugars to control. But that person isn't ready for an injection. However, today they're open to using an oral medication. And while we know that oral medication isn't going to get their blood sugars all the way to their goal, it should help get it partway there. And so today, that's what they're ready for, and that's what we give them to support their goals. And then maybe down the road, they'll be ready to move into the insulin. So really, it's about meeting people where they're at and helping them reduce the harms of their use.